before we start treating those patients, we want to know that we've got clinical trial data showing that we're doing the right thing for them. So it's a large, over a dozen centers across the U.S. are participating in this, and we're fortunate to be part of it.
Great. Thank you so much for your time. And I'll pass this along to John right now. Thank you again.
No worries.
Thank you, Dr. Snelling. Great information, plenty to work with here. I just want to ask you, I think, one or two more questions regarding COVID and neurological impacts. I know there's been several studies about the COVID causing inflammation and blood vessel damage and some neurological impact, but can you confirm? I don't think there's been any studies saying that COVID can cause an increased risk of aneurysms, or can you address that?
I don't think so. I mean, I think there's been some early data showing that patients have perhaps an increased propensity to form clots in the blood vessels, the arteries and veins of the body. And some centers in metropolitan areas that have a high population density have reported their experience with what they perceive as an increased number of patients, perhaps younger, perhaps who don't have risk factors for having clots or plaques or blockages of the brain, having that. I think there are some other, I would counter that with there hasn't been, I'd say, conclusive evidence one way or the other. So there is some early reports that perhaps there's an increased risk of patients, younger patients, healthier patients who wouldn't otherwise have a stroke risk factor, you wouldn't expect to have a stroke, having these clots and blockages with a concomitant COVID illness at the time. Like I said, I think that definitively remains to be borne out with further sort of studies. Certainly, I've seen no reports that it would increase A, the development of brain aneurysms, or B, the propensity for a brain aneurysm to rupture.
Okay.
So I don't think there's a link there.
Okay. And I know aneurysm has gotten some publicity lately. Dr. Dre left the hospital after a brain aneurysm, and I believe some of the stories actually mention how it's more common than people realize. 1 in 50, I believe. Is there anything you want to say about that? I'm not the Dr. Dre specific case, but just that it's becoming more. Are people more aware of your experience with patients? Are they more aware of the possibilities of aneurysms with the publicity or just general, hopefully our efforts of publicizing the risk of aneurysms? Go ahead.
I would hope so. I mean, I think at least locally, I think people are becoming more aware. One thing I would say is that we have some pretty good understanding of who needs to be screened. And it's really incumbent upon us as medical physicians and me as a neurosurgeon to make sure that my own medical colleagues know that they need to be thorough with their taking a family history, or that they need to know that if a patient harbors certain genetic illnesses or certain things like that, that their patients may have that own predisposition. So it's really an education on two fronts. It's an education of the medical community at large, and it's really that there are ways to identify patients who may be at an increased risk for developing a brain aneurysm, such that they would benefit from having a screening test. Certainly, the incidence of brain aneurysms, 1 in 50, doesn't warrant screening the entire population, right? So it doesn't. So you have to really figure out which. You have to sort of cordon off the population that you think is at highest risk, and then say, okay, those are the people that should be screened. And I think we have pretty good data on that. And I've seen patients who have had a brain aneurysm rupture, and you talk to them, and they go, "Oh, well, my mom had one, and my aunt had one." And so you get a sense that there's more screening that could be done, and I think that. And I think there's also people that, again, have a lot of these modifiable risk factors. Many of them are the same risk factors for cardiovascular disease, so high blood pressure, smoking, cholesterol, excessive alcohol use, things like that, that could put them at a higher risk of A, developing one, and B, if they have one, having it rupture.
Great point. I guess I'm good. Thank you very much. This is great information. I learned a few things about aneurysm that I didn't know, and I've written about aneurysms already. So thank you very much. Appreciate it.
No worries. Happy to do it.
Anything else, guys, or team?
No, I think I'm good on mine. That was great.
I mean, Michael, by this time, I feel like you could like clip a brain aneurysm. I swear. I mean, Michael's seen me like give. I mean, he's probably like rolling his eyes. He's like, he could probably tell this. Next time, I'm just gonna have him do it. He knows all this stuff.
No, this is exciting stuff. It's one of those topics that I enjoy hearing about. So I enjoy it.
I was gonna say, I feel like I just got a crash course, like fifth grade level brain aneurysms.
Right.
You know, it's really the same talk I give the EMS teams. I mean, that's essentially the same stuff that they hear. So now you guys are deputized to go out in the public and teach everyone.
Clip aneurysms.
Yeah, sure. I'll tell you when I'm not. I'll tell you when I'm not on call.
All right, I think unless anyone has anything else, I think that pretty much wraps it up. That was a ton of amazing information, so I'm sure it's going to suit us really well, and for Aaron as well. So thank you so much, Dr. Snelling.
Thanks. Take care.
Thank you. Take care.
Thank you.